It presents like any other virus that you might see during the respiratory season, so it makes it pretty tough. So the symptoms that you might see, cough, fever, sneezing, runny nose, those are all the things that we see with just about every other virus that we see this time of the year. So it's a tricky one, and we're doing what we can to try to stay on top of what's important and the guidelines and how we can help not only keep our kids safe, but we want to keep everybody safe. This whole process is a very fluid and changing process. It almost seems today that if you take a nap and you wake up in 5 minutes, all the recommendations and guidelines are going to change. The good news to this point is that it seems that it has not affected children as much as it has adults.
So there's very limited data that we have available in pregnancy. However, there have been case reports of 9 pregnant women who contracted the coronavirus. All of these women were late in their pregnancy or in the 3rd trimester. Thankfully, all the babies were born healthy and there didn't appear to be any complications. There was 1 case of preterm labor out of the 9 cases that I talked about. However, it's not clear that this was related to the infection or it would have happened anyhow. In addition to looking at moms, they also looked at babies to see if there was any evidence of transmission from mom to baby. There was no evidence of viral particles in the amniotic fluid or in the breast milk. Having said that, once the baby is born, mom is likely to interact with the baby closely, and since this is a respiratory virus, there have been case reports of mom transmitting the virus to the baby soon after birth. The other thing to think about is that this virus is very similar to the SARS virus, and we do know from experience that the SARS virus was actually quite dangerous for pregnant women. It led to pregnancy complications like preterm labor and miscarriages. Thankfully, we have not seen that here. However, again, keep in mind we have very small sample size, and all of these women were late in their pregnancy, so we don't actually know what happens in the 1st or 2nd trimester of pregnancy. Now, pregnancy is a relatively immunocompromised state because your immune system actually changes itself when you're pregnant in order for it to not attack the baby. So pregnant women should be considered in the highest risk category because they are relatively immunocompromised and they can be higher risk for certain respiratory infections. We have not seen that with the coronavirus thus far in terms of the rate of infection in pregnant women compared to the regular community, but again, our sample size is very small.